Since Grandma got diagnosed with heart failure and hypertension, she's been having trouble doing the things that she loves. Since her diagnosis, she's been looking for ways to relieve the symptoms she gets from the heavy edema she has in her legs.
I think it's about time I speak with my doctor about this fluid. It's got to go.
I couldn't agree more, Grandma. Hey, Grandma, I'm no doctor myself, but why don't you ask your doctor about furosemide?
Furosemide? What's that?
Furosemide. Most people have probably heard of it by the name of Lasix. It's a medication that can help with some of the problems you're experiencing. Furosemide is a medication that affects your kidneys, and it allows your body to excrete some of that excess fluid when you urinate.
I'll be sure to call him now and see what he thinks.
Find out if furosemide is right for you by talking with your doctor. Furosemide is a medication that is typically prescribed for patients experiencing symptoms of fluid retention, congestive heart failure, liver disease, kidney disease, or other medical conditions.
Dr. Flo, I was wanting to speak with you today about furosemide. Someone told me that it might be a good fit for me.
Wow, Grandma, what a smart friend you have. I think furosemide would be a great fit for you. This medication helps reduce the fluid retention called edema. You have edema primarily in your lower legs. Furosemide acts upon the kidneys and blocks sodium reabsorption. That means instead of sodium staying within the body and keeping fluid or water within, sodium instead goes out of the body. The fluid or water will want to follow the sodium, thus allowing fluid retention to reduce within your body. Let's get you started on that medication today, Grandma. While taking furosemide, please be sure to follow your doctor's instructions. It's important to take the dosage and frequency of the medication that the doctor has prescribed for you. Furosemide is typically dosed at 20 to 80 milligrams once a day as a single dose, or divided and given twice per day. However, each prescription is person-specific and your doctor will correct the dosage for you. This will help avoid any major adverse effects such as hypotension, commonly known as low blood pressure. In some cases, this could be life-threatening, so please be sure to closely follow the instructions set by your healthcare provider. Other adverse effects include low potassium, low sodium, low magnesium, low calcium, dehydration, orthostatic hypertension, high blood sugar, kidney toxicity, which could lead to hearing damage, deafness, ringing in the ears, and in extreme cases, death.
Oh, well, that's good to know. I'll be sure to follow Dr. Flo's instructions.
Grandma, are you talking to me? Well, anyways, yes. Please be sure to follow the prescription. When taking your medication, you will need to check your heart rate and blood pressure before taking this medication for the day. Also, please be sure that while you're on this medication to monitor your weight, daily intake and output, and to get in a lot of leafy greens.
Sorry, Dr. Flo. Yes, I'll be sure to do that.
Okay, thank you, Grandma. I also want to be sure that you know to call me right away if you start to experience any symptoms such as ringing in the ears, dry mouth, increased thirst, muscle cramps, nausea, or vomiting. And Grandma, be sure to avoid other medications such as blood thinners because they can increase your risk of bleeding on this medication. Also avoid other medications that increase the risk of toxic effect to your ears or kidneys.
Well, thank you both. This is great information.
Grandma, who are you talking? Oh, you know what? I'm not a psychiatrist, although you might want to go visit with one of them next. Here's your prescription, Grandma. Furosemide, because when that edema's got to go, you've got to go pee.